Sorry about that. Aloha, gang. Dr. Russ Rosen here. Welcome to the OHC Community Masterclass. That's what it is. That's what we're doing. It's the masterclass today. And I do believe that I can actually see you. So I am going to write a comment and I'm going to say, let me know if you are here and if you have any questions as we go along. And I'll just post that. And then if you, because last time I just started to figure out where you can actually see that. So good news. All right. My goal is to keep this one 15 to 20 minutes. That's my goal. I know they've been going longer and I'm trying to keep them 15 to 20 minutes. So here we go. My favorite subject. Well, one of my favorite subjects is how do we get patients to actually get it? How do we get them to get what we do so they want what we offer, so they happily stay, pay, and refer for a lifetime? And I know that you do amazing work and that you love your patients and that you get frustrated that they don't get it, that they don't get the bigger picture. They don't understand that concept about get healthy and stay healthy and have the best life possible, so they feel better and they leave, or they don't feel better and they leave. But either way about it, they leave. And here's what I can tell you. The answer is not telling them more. The answer is not educating them more. We all hear it by my brother Billy D. You got to tell the story. You got to tell the story. You got to tell the story. And I appreciate it. I love the sentiment, but we need to ask this story, and you'll understand more about that as we go on. So the solution is the neuroscience of communications. In the first two master classes, we dove into who are we, what do we do, why do we do what we do, why don't we do other things. If you haven't been through those, go through those. Go into the guides section, go to master class towards the bottom, and go through the first two. The next two master classes we did were, the first one was on what are we going to communicate in an optimal health model. So we're going to use a care versus care, true optimal health model. What are we going to communicate? And then how do we do it in the sense of what template can we use? And we talked about laser, listen, acknowledge, ask, solution, resolution. And today is all about the neuroscience of communications. So in the neuroscience of communications, it's about getting people to say yes who want to say yes. We're not trying to use an Aikido wrist lock and get people to say yes who don't want what we offer. This is just for that niche market, these people who actually want to get healthy and they want to stay healthy. Now, they may not have come to you thinking that at the beginning, but it's our job to walk them through a process to help them understand that we actually can just help them be comfortable or feel okay versus actually being really healthy. And we need to understand the neuroscience of communications. Now, I got so much of this from Robert Cialdini, the book, The Psychology of Influence, The Psychology of Persuasion, which is probably my favorite book of all time. It's probably that and Loving What Is by Byron Katie, which I've talked about in other ones, other classes that we've done. There's tremendous research in this book where he helps us understand that in normal conversations, there are things that we can do to cause people who want to say yes, and there are things we can do to those same people and cause them to say no. One of the things we utilize in our consultation is a study he did where he had a wait staff person, so waiter, waitress, wait staff, go up to, say, 3,000 people at a restaurant and say, oh, okay, great. So you would like a ham on rye, hold the mayo. The other 3,000 people, the person who said, I'd like a ham on rye, hold the mayo, they would say, you'd like a ham on rye with no mayo. Now, one said ham on rye, hold the mayo. One said ham on rye with no mayo. What they found was if you said the exact same words, hold the mayo, you got a 23% bigger tip on average. Whereas if you didn't use their same words, you got 23% less of a tip. Well, is that because they thought, well, you're not a good waiter because you didn't use my words, and therefore I'm going to calculate out 23%, not give you the tip? No, not at all. It's just that when we use their same words, when we echo them, we feel in rapport, they like you better and they give you better tips. Well, would that be valuable to know in relationship to connecting with your patients? And the answer is yes, absolutely, no question. So our entire communications program, and we're going to start diving into pieces of it, not next week because it's an off week and I'm going to be in Maui, thank goodness, with my little grandson. But the following week, we're going to start diving into how do we utilize this? How do we apply it? So we'll look at the doctor's consultation and we'll start to really learn how to use the neuroscience of communications. But I'm going to just lay this out for you, little tiny chunks, and then we'll dive into actually how do you apply it. Now, also another piece is remember that all buying decisions are made from this subconscious part of our mind called the limbic system. It's not the neocortex, thinking, reasoning, problem solving. So really, we've got to get we've got to get it past here into the subconscious part for them as far as buying decisions goes also. Okay, so let me ask you this. Has this ever happened to you? And I do see Ian Griffiths. Thank you. Aloha to you, brother. Good to see you. I'm not just talking to my webcam right here. I appreciate it. Has it ever happened to you where you've had patients, they seem to be with you every step of the way, and then their eyes glaze over and they start to drool? It goes like that and slaps them in the face. They appear to be with you, but then they have to go home and think about it. And the answer is yes, that has happened to you. You've been doing a health talk and that happened. And just really understand that the bad news is you caused it, most likely. And the good news is you caused it. Because if you caused it, you can do something about it. So when we understand the neuroscience of communication and we apply it by design, we have a better chance of them actually hearing us, of understanding us, of getting us. And if they do, is it possible that they have a better chance of actually staying with us? And the answer is yes. Like we hear it all the time. If they knew what you knew, they would do what you do. Or we hear, what I say is if you can get them to get it, they will happily stay, pay, and refer for a lifetime. Okay, well, great. Is it true? Yes, of course it's true. And again, bad news is if that's not happening, if you're not having enough people really get it, if you're not having a high enough internal referral rate, if you don't have high enough retention, if you don't get enough, all of those kinds of things, then you're probably causing it. Again, the good news is if you're causing it, you can fix it. So we need to start with there's a gap. Realize that there's a gap. They come in thinking you can help me with neck pain, back pain, headaches, depending upon what kind of practice you run, what kind of doctor you are, etc. They're coming in with some type of a symptom, but you recognize you can help them get healthy, stay healthy, and have the best life possible. So there's a huge gap between the two. So we have to get them to get it. If you're running a pain-based practice where you're just going to, crack their neck or whatever you do, and as soon as they feel a little bit better, they stop. You really don't need to know all this stuff. But if you actually want to help them get what you do and value your care, then you got to learn to speak in a different way. Again, we want to utilize the neuroscience of communications. So let's look at this. We've got the reptilian brain. What does the reptilian brain do for a living? Anybody remember? Right, it's about survival. It's food, fighting, and fornication. So the registration boards frown on that. Don't food, fight, and fornicate with your patients. Okay, but that's what the survival brain is all about, right? 94 to 98% of all information coming in does not make it past the reptilian brain to the neocortex for thinking, reasoning, and problem solving. Okay, so the reptilian brain is filtering, and if it's not really, really important, it just doesn't get past that part of the brain to the neocortex for thinking, reasoning, and problem solving. Okay, now, if it does get past the reptilian brain, and it does make sense in the neocortex for reasoning, thinking, reasoning, and problem solving, it'll drop into the limbic system as a new belief system. Right? This is where our emotions are, this is where belief system is, and this is where the buying decisions are going to be made from. Now, the other part of the brain we need to be aware of is the amygdala, right? Two little almond-shaped things, and that's fight or flight. If they're in fight or flight, if they're anxious, if they feel fear, if we're using scare tactics, they're not sending it to the neocortex, they're in fight or flight. Because when you're running from the lion, you don't need to think and reason. and wonder what continent it came from and how much it weighs. You need to run. Okay, so we want to get them out of fear. We want to open their reptilian brain and send it up to the neocortex for thinking, reasoning, and problem solving, so it drops into the limbic system as a new belief system. All right, so what if the reptilian brain doesn't send it to the neocortex? So I want you to imagine you're sitting in class, right? And you're thinking, God, it's a gorgeous day out. I would love to be surfing. And you hear the teacher droning on, wah, 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 and that'll be on the test. And you hear all the rustling of papers and what'll be on the test, right? Because that was important. So your reptilian brain said, you better listen to this. Problem is, none of it prior to that made it to the neocortex. You have no idea what they're talking about, and you can't retrieve that. Same thing. You've got a new mom and dad with a little baby. Baby is crying, right? A lot, keeping them up. They're not getting a lot of sleep. They're in New York, near a subway, right? You know, trains are going by, police cars are going, you know, people are shooting. I mean, there's all this noise. They sleep just fine until the baby cries. Then it wakes them up. That's your reptilian brain. That's part of the brain that says, wake up, this is important. Now, in an average conversation, we hear about 25% of what the other person is saying on an average conversation. You know, the rest of the time you're thinking about how you're going to respond, that you got to pick something up from the store on the way back. That's a really nice shirt that she has on, blah, blah, blah. But, you know, we're not hearing 100%. My question to you is, what percentage of the information that you want to get across to your patient would you like them to hear? And the answer is 100%. It's 100%. You would like them to hear 100%, and I guarantee you can do it. And as we go through these next master classes, I'll prove it to you, that you will literally ask them questions and they got it or they didn't. If they didn't, you know, have an opportunity to get them to get it, but they're going to get it. Period. Okay. So here's the problem. The problem is the reptilian brain is filtering 94 to 98% of the information. We need to get it past the reptilian brain, but that reptilian brain really is there for food fighting and fornication. So is there something else we can do other than the 3 F's? And the answer is yes, we can. But the first thing we need to understand is that what we were taught was to speak from my neocortex to your neocortex. That's what I'm doing with you right now. But I don't have you in a Zoom room. I can't be having a conversation with you. I have to be lecturing at you, right? So that's how most of us, mothers, fathers, teachers, preachers, have done. That's how we've learned all through school, by somebody educating us, someone telling us. Again, the problem is it really doesn't work very well. So if we want to get the message past the reptilian brain, we need to start to quit speaking from our neocortex, thinking, reasoning, problem solving, to their neocortex. Where do we need to speak to? We need to speak from our neocortex to their what? To their reptilian brain. If I can learn to speak to your reptilian brain, it will naturally send it up to the neocortex, which will naturally think, reasoning, and problem solve, which will naturally drop it into the limbic system, and it becomes their idea. So you're going to see, we're going to talk about, you draw their story out, you take your story, apply it to their story, it drops into the limbic system as a new belief system. So how do we do that? Well, I'm glad you asked. Step one, we need to make it new, novel, and exciting. And in essence, all you have to do is make it about them. Okay? Lion is asleep 21 hours a day, doesn't wake up till it smells a gazelle. Sees a gazelle, wakes up. Right? Now it's paying attention. That's what we got to do. We got to get it past the sleeping lion, past the reptilian brain. So all you have to do is make the conversation about them. Well, that's easy because they're here to talk about themselves, specifically their aches, pains, problems, health issues that no one else wants to listen to anymore, right? So it's a really easy thing to do. So if we make it new, novel, and exciting by talking about them, all we have to do is use stories and metaphors and use Socratic questions. What's a Socratic question? Well, here's an informational question. Ian, what's your last name? Griffiths. Right, that's your last name. You already knew that. Is that a Socratic question? No, you already knew it. What's a Socratic question? A Socratic question is who, what, why, where, when, and how. A Socratic question is something that makes them go like this. You'll literally see them send the information up to their neocortex. Why do you think this isn't getting better? What do you think brought this on? What level of health would you like to get to? What kind of changes might you need to make? All of those are going to cause them to think, which means it gets to the neocortex for what? Thinking, reasoning, problem solving, and it drops into the limbic system as a what? That's right, as a new belief system. So, and again, in the upcoming modules, we'll be diving deeper into how to actually apply this to your consult, exam, report of findings, daily interactions, re-exam, re-reports. I'm just trying to give you the foundation of it right now. So we're going to make it about them. We're going to use Socratic questions, and we're going to use stories and metaphors. Now, we've all heard about how important it is to use Socratic questions. I've not seen other people teach how to do that, to show you the exact questions to ask them what you're trying to accomplish, which is kind of my claim to fame of what I do. So again, remember, most buying decisions are not made from the neocortex. They're actually made from the limbic system. So I want to draw their story out, take my information, and instead of cramming it down your throat, I'm going to apply it to their information or their story. It'll drop right into the limbic system. 8-ball corner pocket off the side, and it works really, really well. So here are the filtering instructions. This is what the lion, the reptilian brain, is saying. If it's not dangerous, ignore it. If it's not new and exciting, ignore it. If it's new, summarize it as quickly as possible. Forget about all the details. You can send that little bit up through. Don't send anything up to the neocortex for problem solving unless you have a situation that is really unexpected or really out of the ordinary. Okay, so that's why the reptilian brain is not sending that information up, because if it's not really important, right now, if you go like this, can you feel your shirt? Yeah, you can. A moment ago, you didn't. Why? Right? I mean, I remember I was sleeping in Maui and back when I had long hair, and I was dreaming of like a dinosaur, of a creature of some sort, and I had just gone like this and moved like a 9-inch centipede out of my hair, like that. That woke me up. Right? Like that's what the reptilian brain will do. It's say, this is important, wake up. So the name of the game is to get their attention and keep their attention. That's the name of the game. Get the reptilian brain's attention and keep the reptilian brain's attention. Okay, so my hope is that you see the value of mastering the neuroscience of communications. How do you integrate it? We're off next week, right? I'm going to Maui to be with my grandson and my little kidlet. And then when we get back, we're going to dive into the consultation, and we'll be looking at very specific pieces of what do we need to do and how do we utilize the neuroscience of communications. And then if you ever like do our program, you'll see that sprinkled throughout the entire thing. It's there every step of the way. So again, I want you to start thinking about, you're going to draw their story out of them, keeps them engaged. They're talking about their favorite subject. Then you're going to take your story and you're going to apply it to their story. It'll drop right into the limbic system. So let me see, that was 18 minutes. I was trying to keep it under 20. So good. Maybe the next one I'll be able to pull off around 15. We'll see. If you have any questions out there, you can go ahead and put it in the chat box right now. I just see one that Ian is there. Aloha, Ian. Thank you for being there. If you do have any other questions and you're watching this on the replay, just put it in the comment section and I will respond. All right. So hope you found great value. As always, much love and aloha. Bye, gang.